pelvic issues are most often dismissed, but there are concrete signs that definitely point towards pelvic stability as the cause of these signs and symptoms. The dysfunction shows up as a mixture of symptoms. It can be pain, it can be pressure, it can be bowel, bladder function and issues, sexual function or dysfunction, I should say, and unexplained tension inside the pelvis. Therapy should be done to provide stability first before strengthening. If you're stable, you can work on stability, on strengthening. If you are not stable, your strengthening attempts will not materialize. Some of the common signs of pelvic instability, other than what I just mentioned, are chronic lower back pain, chronic sacroiliac joint pain, chronic or pain in the tailbone. You can have poor posture. You can suck your tummy in, hold your breath. You can have pains in the perineum, in the genitals, around the anus. You can feel pressure like you're sitting on a golf ball. There is tension in the perineum. There is burning sensation in the genitals. It can be abnormal sensation, feeling cold there. The bottom line here is that inside of your pelvis, where you see these muscles, these are voluntary muscles. They are impacted by your breathing. In fact, breathing, biological breathing, is how nature relaxes these muscles, and how in the process of breathing out, these same muscles come together to initiate the breathing out process. So at a frequency of every breath, we are conditioning these muscles to be nice and relaxed and tighten effectively and efficiently. When that doesn't happen, we're in trouble. These muscles work with the outside surrounding to provide stability. The reason that's important, you've got double reinforcement, is because the pelvis is a foundation to the structure above, and when the foundation is unstable, the structure above is unstable, and that's compromising your health and your existence. So when the outside environment does not provide what it needs to, the inside makes up for it. The problem there is the inside has a limited space, and when it tenses up, whatever resides here is going to be compromised. So your symptoms vary as much as I explained to you, because there are pelvic organs here. There's your intestine, there's your bladder. If you're a male, there is your prostate. If you're a female, it's your uterus and your ovaries. The tubes that connect these to the outside. You have your nerves, you have your blood vessels, that's your arteries and your veins. You can have, or you do have, ligaments, muscles, joints that are being impacted. So the signs and symptoms depend on what organ or organs are being compromised. That's why it's such a wide range, and that's why when it comes, for instance, if you have chronic lower back pain, you have pelvic instability. It's impossible to have stability there. And you don't look at it as pelvic floor dysfunction, you look at it as back pain, or oh, my posture is bad, and everyone's looking to strengthen their body. Listen, as a baby, you were born, you could barely hold your head up. Somehow you became a running toddler. No bands, no gyms, no weights, no guidance whatsoever. We're hardwired to do it this way. Our body parts know exactly what they are to do if we provide the environment. The problem here is we're not providing the environment, and that is why that's happening. So if you have any of these signs and symptoms, you have pelvic instability, you have pelvic floor dysfunction. Don't go to the gym and try to strengthen. That's like trying to build a structure over a foundation that's on a swamp. It's unstable. So work on the right things first. When it comes to fixing instability, I always start with biological breathing. Why? Because that's how nature does it. Biological breathing. You were born with the breath as the first thing that took place. That wasn't because you went from liquid to gas environment. That, well, of course that was, but that's one of the many things that your breathing does. Your breathing is like a power cord to your laptop. Your laptop may have a lot of softwares, but you can't access it without electricity, without power. So breathing is the initiation of fundamental actions and functions in your body. So we do biological breathing. If you had subscribed to my channel, you'd know exactly how to do that. If you haven't, please subscribe to my channel. Make sure you turn the notification bell on. We'll make sure we put it at the end of this video. But biological breathing is how we initiate the process, and we go through developmental exercises. Developmental exercises, like I said, are the same exercises every single one of us did at every stage of our development until we became running toddlers. This is how you stabilize your pelvis. This is how your brain knew it, your body part did it, and every walking human being has done it. If you had not stabilized your pelvis, you would not have walked. It would have taken you forever to do it, but as a baby, you don't have a quit button. So you did everything until you built the strength to move to the next step. So this is very, very important for you to understand, because being busy is not always productive. So busy yourself with the right task, understanding the concept of movement, how that's done, what right looks like, what your version is, and how to turn your version into the right, and how to maintain this until the last breath. That's what it's all about. That's what I do in my practice. That's what I teach my patients and my clients what to do, and that's the essence of independence with movement and balance. Thank you so much for watching. Until next time, take care.